unique insights.
Thank you very much, Maria, and thanks for the invitation of the Harvard University for this eminent faculty. I have no conflict of interest to disclose for this webinar. I'm delighted that my colleagues have already eloquently described the relationship of diabetes and COVID-19, which primarily focuses on the problems of hyperglycemia as well as the presence of other comorbidities such as cardiac disease or other complications. I cannot talk about the Middle East because the Middle East is not just one country. We have huge variability when it comes to the region, when it comes to wealth, when it comes to health systems, and when it comes to stability. Some of them are war zones, or some are in a very well prosperous situation. In fact, also when you think of the density of population, some countries are less than 2 million in population and others are over 100 million. So consequently, all of this, when it comes to the management of COVID-19, it has impacted on different measures of quarantine, different measures of social distancing, and enforcement of the social distancing measures has been quite variable from one country to another. The rates of testing...
Are you able to speak up just a little bit, please?
Sure.
Thank you.
When it comes to the different testing ability, this has also been variable. I currently live in UAE, and the level of testing has been excellent. So when it comes to data from the region, I don't think it's available yet. I know that the research is ongoing. But as it has been mentioned, the peak of the COVID-19 has been also met with the start of the month of Ramadan, which started on the 24th of April. Fasting from dawn to dusk, fasting for 16 or 15 hours or even longer, depends on where you are globally, when potentially the weather is hot, could lead to some levels of complications. So the classic scenario was, so many people are asking, is it safe to fast or not? So many experts globally were approaching Dar International Alliance, saying, what is the position? We know that the vast majority of people fast with no problems during the month of Ramadan. But for some, there is the problem of ketoacidosis, hyperglycemia, dehydration, and thrombosis. And all of these are very much related to the risk of COVID-19. Hypoglycemia obviously also increased for many. There's a question as well of SGLT2 inhibitors. This is an important class of drugs that many of our people with diabetes has now been taking because of the evidence with SGLT2 inhibitors. But when it comes to the issue of I'm not going to be able to drink at all for the next 16 hours, we know that dehydration and thrombosis could be a problem. Is this something going to be worse for a person who is diabetic taking SGLT2 inhibitor in the COVID era time? Now, if we look into the literature of what we have published over the last 5 or 10 years, we will see that the vast majority, as I mentioned, fast with no problems. Hospitalization in CREED study, which we published 5 years ago, was 0.5%. And half of these hospitalized was nothing to do with diabetes itself. More recent data that we published in the RCP last year, looking from the MENA region of 1,800 persons or so, that hyperglycemia actually dropped during the month of Ramadan from roughly about 15% to about 11.6%. And the severe form of hyperglycemia that needed medical assistance also dropped from 2.2 to 1%. Ketoacidosis is something obviously of concern during the COVID-19 era. And for Ramadan fasting, there is a number of studies that have looked into rates of DKA. This is a study that we collaborated in our center with 4 other countries, and we published 4 years ago, and we looked into cases of admissions of ketoacidosis during Ramadan and the month after. And interestingly, that the Ramadan data is higher, but the month after is even higher. Whether this coincides with the celebrations after Ramadan or relaxation of the therapy, we don't know. But we know that currently at that time, traditionally the cases of DKA would be higher than normal months, and during Ramadan it will also be high. Going to the SGLT2 inhibitors issue, we have 5 different studies during the month of Ramadan. I've been lucky enough to be part of 3 of them, and in all of them we have seen safety. We have not seen any ketoacidosis, any hospitalization, any serious markers for dehydration, but all of these studies were done in not in the elderly, not in the person with renal impairment, or not in the person with hypertension tendencies. So our recommendations was carry on taking your SGLT2 inhibitors. If you fall among one of these groups, then you need to be cautious, and we need, as healthcare professionals, to rethink whether we reduce the dose or what exactly should we do. But going to the point of COVID-19 and SGLT2 inhibitors, in our paper which just been published in Diabetic Medicine among my colleagues from UK, we have exactly said that. Carry on with the SGLT2 inhibitors unless the person is infected with COVID-19, where then you have to look into this. What about the diabetic person with cardiac condition? We did this study from my hospital here in Dubai, and we looked into intensive management for them. Intensive care is not the right word now to say, but optimum care it was, with education, with freestyle monitoring, and with dose adjustments. And with this, we found that the cardiometabolic parameters improved. Indeed, the glycemic control improved markedly. But what was concerned is what you see here on this part of the box, that hypoglycemia events and duration doubled as per the flash glucose monitoring data to 117 minutes versus 49 minutes out of Ramadan. And the same applies to the second study we did in our center, published also last year, and this looked into patients with chronic kidney disease stage 3. So you see that creatinine and eGFR did not significantly change, blood pressure improved, HbA1c improved. None of them were statistically significant, but what was statistically significant was the events of hypoglycemia and the duration of hypoglycemia. So with all of this, we were concerned with hypoglycemia. So coming to the point of which of your patients you should advise not to fast because of COVID-19. And actually, it is, if you review the recommendations we published of diabetes and Ramadan in collaboration with the IDF, it's exactly the same person. The very high risk is the poorly controlled person, whether type 1 or whether type 2, the person with acute illness, the person with chronic kidney disease, whether stage 3 or more advanced, the person with macrovascular disease, whether stable or advanced, and certainly the older group of people who has ill health. So all of these people, we have in the past been saying, do not fast. We acknowledge that in many cases, many people were ignoring these advice and these guidelines. And that's why we thought, in collaboration with the IDF, we have published and put on the website of the IDF these points, and shortly afterwards, the diabetic medicine paper with the colleagues from UK was published with more or less the same point. So here is our points of, in red, what is the issue with Ramadan? The issue is the concern for some about hyperglycemia, or if they have coexisting complications. And consequently, these are the group of people we say avoid fasting. The person with persistent high blood glucose, the person with recent DKA or recent very high blood glucose levels, the person with cardiac condition, renal condition, foot infection, the elderly with poor health, and those, of course, with acute illness, including, of course, if they have the COVID-19 virus being positive. And we simply said to them, please, 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 listen to the advice. Stay at home. Follow all the general advice for COVID-19. Take it to heart. Avoid, if you're going to fast, avoid excessive intake of food that is rich in glucose or rich in fat, as sometimes happens when people celebrate. Regular monitoring of blood glucose is essential. Plenty of fluids, plenty of water and unsweetened drinks during the non-fasting hours. Of course, stopping the fast when a person has hyperglycemia is mandatory. And then looking into the cause and trying to overcome that cause and communicate with the diabetes team. And do not resume fasting unless the cause of the hyperglycemia is settled and you are safe to do so. And with this advice, I think some of our patients, I hope they have benefited from it. I would like now to stop sharing my slides and hand over to yourselves.
Thank you, Mohammed. That was a fantastic presentation. Thanks for sharing your experience. And even though Ramadan is over, I think that there's a great opportunity to learn from all this, and I think to be applied not only in the future when Ramadan is again here, but also I think that, as you pointed out, the importance of diabetes education, and I think that's crucial along the way for the improvement of diabetes care. So thank you, Mohammed, for sharing your experience on that. And talking about diabetes education and other important things on the practical aspect.